Hi, my name is Caroline Mason, and today for this presentation we're going to be talking about interpreting arterial blood gases. For this first part, we're going to watch a video just to get an introduction to the topic at hand today. We're going to be talking about ABGs. Just give me 1 second. We're going to X out and we're going to go to the video that we're going to be watching first.
Hey there, future nurses. It's Christine from Nurse in the Making, and today we're going to talk about the foundational concepts of ABGs, arterial blood gases. Before you dive into the difficult ABG questions where you're interpreting the values, you must know the foundational concepts first. So let's get started. If you want to follow along in the Complete Nursing School bundle, I'm in the ABG section. What are ABGs? ABGs stand for arterial blood gases. It's just what the name says. It's a measure of the amount of different gases and pH in your arterial blood. ABG testing is most commonly seen in the ICU. It needs to be taken from an arterial line, or it can be taken through a puncture. It's not the same thing as a venous puncture. ABGs measure your pH, measures the amount of carbon dioxide, written as PaCO2, the amount of bicarbonate or bicarb, written as HCO3. It measures partial pressure of oxygen, written as PaO2, and it also measures your oxygen saturation, written as SaO2. Let's talk about the normal ranges. You must commit these to memory if you want to ace these ABG practice questions. You want to know these like the back of your hand. So the normal range for pH is 7.35 to 7.45. CO2 is easy to remember because you just take off the 7 of the pH and you get your value for CO2, which is 35 to 45. The normal range for HCO3 is 22 to 26. PaO2 is 80 to 100, and SaO2 is 95 to 100%. And just note that PaO2 and SaO2 are not needed to determine alkalosis or acidosis. It just tells you if your patient is hypoxic or not. You still need to know these values as a nurse, but you don't need them when answering ABG questions. First, let's talk about pH. pH is the measurement of hydrogen ions in the blood. It indicates how acidic or alkalotic your blood is. The lungs and kidneys are constantly balancing and adapting to maintain a normal pH. A normal pH is, do you remember? 7.35 to 7.45. The middle of that is 7.40, which is considered the absolute normal. Anything less than 7.40 is becoming acidic, and anything greater than 7.40 is becoming more alkalotic or basic. Note that alkalotic and basic are used interchangeably. They mean the same thing. Next on the list is carbon dioxide, written as PaCO2. PaCO2 is a measurement of carbon dioxide in your blood. This is a reflection of how well CO2 is able to exit the blood and be exhaled, thus maintaining a normal pH. A normal CO2 is, do you remember? 35 to 45. Now CO2 is a little different than pH. CO2 is acidic. You can remember this by the memory trick, CO2 is an acid. So the more CO2 you have, the more acidic your blood is. The less CO2 you have, the less acid you have in your blood, meaning it's more basic or alkalotic. Next on the list is bicarbonate, written as HCO3. HCO3 is a measurement of bicarbonate in the blood. It maintains the blood at a normal pH. It does this by acting as a buffer. A normal HCO3 is, do you remember? 22 to 26. HCO3 is different than CO2 because HCO3 is alkalotic, also known as basic. You can remember this by the memory trick, bicarbonate, think base. So the more HCO3 you have, the more basic your blood is. And the less HCO3 you have, the less basic your blood's going to be, meaning it's more acidic. So let's talk about how these gases are regulated. CO2 is regulated by the lungs, and HCO3 is regulated by the kidneys. So if CO2 is out of range, you know you have a respiratory issue, which remember is regulated by the lungs. And if HCO3 is out of range, you know you have a metabolic issue, which remember is regulated by the kidneys. The lungs and the kidneys compensate a little bit differently. The lungs compensate really quickly to respond fully to changes in pH. This makes sense if you know the anatomy of the lungs. You inhale oxygen and you exhale CO2. The kidneys compensate very slowly. It could take hours to days to compensate and return to homeostasis. Well, how does CO2 and HCO3 actually compensate? The lungs compensate by either hyperventilating to release CO2 if the body's too acidic, or hypoventilation to keep CO2 in the body if the body's too alkalotic. The kidneys compensate and balance pH by two ways. It either excretes hydrogen ions into the urine, or it reabsorbs HCO3 from the urine. That's all for part one.
Okay, so from that video, we did learn some great information that we're going to continue to implement within this course. So, next up, we're going to talk about what is an ABG. First off, an ABG is an arterial blood gas. As she said in the video, it's either obtained off of an arterial line or an arterial puncture. Also, so what do ABGs give us? ABGs give us results that provide us with the patient's gas exchange, ventilatory control, acid-base balance. So the big things here is we're trying to figure out, are we on the right respiratory support? Or is the acid-base balance within defined limits? Or do we need to intervene with a nursing intervention or a medical intervention? How do we use these results from the ABG? Well, we use these results to make sure that the metabolic and respiratory components are being treated correctly and make sure that we are doing the appropriate interventions for the patient. It is the gold standard for assessing the need for acid-base correction, oxygen supplementation, and ventilator therapy. So as far as for our lab values, like she kind of went over in the video, we're going to go over again. So for your pH, you have 7.35 to 7.45. So 7.35, anything less than that would be acidotic, and anything greater than 7.45 would be considered alkalotic. As far as for your PaCO2, alkalotic is less than 35, and then acidotic is anything greater than 45. As far as for your bicarb, anything that is less than 22 is acidotic, anything greater than 28 is alkalotic. A lot of times what I do is I actually flip the 35 and 45 whenever I'm writing my numbers down, so then that way I know everything matches. So everything on the left side would be acidotic, anything on the right side is going to be alkalotic. So nursing interventions for ABG results. So the big thing here is, as nurses, we are the first ones to see ABG results usually after the lab has sent us the critical value. And we must appropriately intervene, which is most of the time just notifying the appropriate medical team member to intervene. It's imperative that nurses report lab values to the appropriate healthcare personnel because medical interventions may need to take place immediately. We're just going to watch this quick video. We're not going to watch the whole thing, but we're going to go into this video now.
Okay, now part 2 of this video showing you how to solve those darn ABGs. Now, a lot of students and instructors use the Rome or tic-tac-toe method, but that can get really confusing, especially when we get into partial versus full compensation. So I personally created the marching band suit method for myself during nursing school and have never got a question wrong in over 8 years now. So I recommend using this chart and writing it out 5 to 10 times every single day the week of your exam. So pause your screen and write this down, then we'll break it down and I'll explain why it's so perfect. Okay, now this chart is so great because it's so organized. Starting with the names here first on the left side. pH is on top. So just think pH is primary because it comes first. CO2 is second. So you see the 2 there. So that's how you know it comes second. And HCO3, well, just look at the 3 there. That's how you know it's the third one down. Next, you just draw normal anatomy. Lungs.
For the purpose of this assignment, I'm going to skip back to the to the PowerPoint, just to make sure that I get through the entire PowerPoint. But if I was doing this in a classroom scenario, I would watch the entire video with the students. So we're going to go back to the beginning, the PowerPoint, and discuss the rest of the information. So how I would go about this is we would do a practice problems. So as a class, we're going to read these questions together. So I'm going to release the information. So this is the question. This is the patient's ABG lab values. So we're going to go through it together. So for the pH, can we talk about that? That's going to be acidotic. The CO2 is also acidotic, as well as the bicarb is alkalotic. So if we were going to interpret this gas, we would interpret it as partially compensated respiratory acidosis. For our next practice problem, we are going to reveal the results of the ABG. So for the pH, we have 7.48, which is leaning on the alkalotic side. Then you have your CO2, which is normal. Then you have your bicarb, which is also alkalotic. So this means because the CO2 is normal, this is uncompensated metabolic alkalosis. And that's because the pH is on the alkalotic side and the bicarb is on the alkalotic side. And then the CO2 is becoming is normal. So it is normalizing the, it's not doing anything. It's not trying to compensate. And so the answer is going to appear here in just a second. Perfect. So our next practice problem is right here. So I'm going to let you guys think about it for a second, and then we're going to go over it. So for the pH, we're acidotic. The CO2, we are alkalotic. The bicarb is acidotic. So as you can see, the pH is not normal, and the bicarb is acidotic as well. So we're looking at partially compensated metabolic acidosis. And that is because the CO2 is alkalotic. It's trying to correct, the body's trying to correct itself. All right, we are going to do 2 more together, and then we're going to do them separately in small groups. So for the pH, it's 7.44, which is considered normal. The CO2 is 49, and which is considered acidotic. The bicarb is considered alkalotic. So the answer here, does anyone want to shout it out? That's correct. It's fully compensated metabolic alkalosis. As we move on to practice number 5, this is the last one we'll do together. And this is the results of the patient's ABG. So the pH is 7.31, which is considered acidotic. The CO2 is normal, and the bicarb is acidotic. So this means that the answer is metabolic acidosis. For the purpose of this assignment, I'm just going to skip through, but these ones are the questions that the students would do on their own, and then we would talk about them together. Big thing here is, does the class have any questions? Well, I want to know, like, what do you guys want to see more of? What do they not understand? What more can we do to make them feel more confident in getting ABGs interpreted? They have the opportunity to ask as many questions as they would like, and that would be the conclusion of this PowerPoint. Thanks so much. We're looking forward to seeing how the students do.